Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we face problems in the healthcare system and then take actions to try and make a better system for all of us. We're going to be talking about upcoming actions in Congress, as well as some new advances regarding immune kind of therapies. But before we get there, down below in the YouTube description box is a link to the Healthcare Advocacy newsletter. That is the text for today's video. It has all the links to the medical journals I reference and actions, as well as a whole host of references down at the bottom of the newsletter. You can subscribe for free. Let's get started. I want to talk about soothing the immune system. Now, when the immune system overreacts and starts attacking the body, the only option is sometimes to shut down the entire immune system and kind of reboot it. However, it's dangerous because it puts the patient at risk of developing all kinds of infections or even cancer. Well, it turns out that some scientists at UC San Francisco have found a more precise way to dial the immune system down. The technology uses engineered T cells that act as immune referees to soothe overreacting immune responses. They also can mop up inflammatory molecules so they don't hang around and create havoc. The new approach could be used to stop the body from rejecting transplanted organs and tissues, such as pancreatic islet cells, which are sometimes used to treat type 1 diabetes. That way, recipients would not need to take harsh immunosuppressant drugs. The scientists tailored a batch of immune referee cells to search for human pancreatic islet cells and then produce TGF-beta and CD25 molecules that can muzzle killer T cells. They introduced the engineered referee cells into mice that had received a transplant of human islet cells, modeling the treatment for type 1 diabetes. The referee cells found the vulnerable islet cells and stopped the killer T cells from attacking, and the islet cells survived. Organ transplant patients or those with autoimmune diseases could receive therapies that only treat the specific region of the body where the immune system is misbehaving, instead of shutting down the whole system. This could prevent significant side effects that people experience when they take general immunosuppressants, and it could prevent infections and cancers that arise when the immune system is disabled so completely. The new technology could also be used to fine-tune CAR T cell therapies for cancer, so the CAR T cells only attack tumors. That is like the gold standard, and not healthy tissues. Anyway, in the newsletter, you'll find a link to the University of California, San Francisco report on this research. I want to talk now about politics and healthcare. Republicans are now looking to cut Medicaid. Now, in case you don't remember, that was a part of Project 2025's playbook for the new Trump administration, as was privatizing Medicare and cutting back on nutrition programs for the poor. Now, for over a decade, top Republican senators like Rick Scott, who used to head up HCA in Florida, the International Healthcare and Hospital Corporation, who, by the way, his corporation, under his leadership, was convicted criminally and civilly of Medicare and Medicaid fraud and had to repay $2.3 billion. Go figure. Anyway, he has been pushing the infamous budget proposals, proposing massive cuts to Medicaid and Medicare because he wants the money to go into his pockets and his friends' pockets. Anyway, with a Republican, that's my opinion only, of course. With a Republican trifecta in charge, everything is on the table, from a higher retirement age for Social Security to new requirements for Medicaid to cut enrollment numbers. They want people out. Republican legislators are looking for savings wherever they can because they want to pay for the tax cuts for the wealthiest Americans. Let me give you a sample of interviews. If you go to the newsletter, I have links to the actual interviews, and you can read them if you can keep your lunch down while you read it. Senator Chuck Grassley, Republican of Iowa, we're going to look for savings wherever we can, and that might include health care issues, he told Axios on December 16th. James Comer, Republican from Kentucky, everything's on the table. On December 12th, the House Oversight Committee chair told CNN, P.S., he thinks everyone is cheating the government. Let me tell you something. When they say things like that, that doesn't mean it's true. What it means, it's projection. Keep that in mind. He has a problem with when he was a state representative with some issues that look like fraud. Anyway, Representative Tom McClintock of California, another shining light, called for strict work requirements in back of all those entitlement programs. A lot of places have tried that, and it doesn't work because the people who need the entitlement programs, or they're safety net programs, getting them to work doesn't do it. Providing health care gets them to work. Shoot me. Anyway, Representative Mark Alford, also a Republican, said we can move the retirement age back a little because he thinks people are living longer. Well, in some states they are. And do you know what states those are? Well, I'll tell you. States that have expanded Medicaid, have good worker protection laws, and lots of gun safety laws. Not in the Republican states that don't have those. I got news for you. Louisiana is the shining star in the toilet with the lowest life expectancy in the country. Okay, Rand Paul, another gem, says, I'm looking at entitlements on December 6th. He told, of course, Fox News. Ralph Norman, a Republican from South Carolina, everything's on the table. That includes Social Security, Medicare, and Medicaid. Listen, if you're poor, if you need Social Security, you're in trouble. Republican legislators want to make your life worse because they want to enrich themselves and their friends. Summary, Republicans are looking for a get-rich-quick scheme to cut taxes for the wealthy and keep corporate taxes very low. They pretend to care about the budget, but increasing deficits by not collecting taxes shows, guess what? They're lying. They refuse to take in enough money because their goal is to bankrupt the government so they can cut out the entitlements. Shoot me. Anyway, to minimize the effect of giving money to the wealthy, they will take it away from the poor. By the way, there are 80 million people in this country who get their health insurance from Medicaid because we have a poverty problem in this country. Keeping people away from doctors makes them sicker and less productive. If you were really pro-business, you would have universal health care, like our 35 industrialized peer nations. Industry in those countries have way lower expenses because universal health care just costs less. Ask anybody in Detroit in the auto industry how hard it is to compete with Toyota when Toyota doesn't have to pay that much for health care. Look, no matter how you implement it, universal health care will cost less, save money for everybody, cover everybody. It saves $400 billion. Did I get that right? Mm-hmm. Every year in wasted overhead. It is just disgraceful. Anyway, let's take an action. Let's let our elected senators and members of Congress know that paying for tax cuts for the wealthy by denying health care to the poor is just cruel and bad business. You can reach them at https://www.usa.gov/elected-officials. That's in the newsletter. It's also in the YouTube description box. Or my favorite, on your cell phone, grab your cell phone, send a text message. The recipient is 50409. That's ResistBot. And the message you'll send is sign, SIGN, space, PDPOQM. Sign PDPOQM to 50409. I'll read it to you. I'm your constituent, and I am appalled that Republicans are preparing to cut Medicaid to fund their tax cuts. The tax cuts are a gift to the wealthy by taking health care and other services away from the poor. Let me remind you that there are 80 million people whose health depends on Medicaid, and that states that expanded Medicaid have a healthier, more productive population than those 10 states, my apologies, that won't. The real answer is universal health care that covers all of us, since it is better coverage at lower cost. But until we get to universal health care, I strongly urge you not to vote for any cuts to Medicaid this upcoming session. Thank you. That's what I've got for you today. Down below in the YouTube description box, you can like, share, subscribe, send me comments. I'll answer them as fast as I can. Maybe you want something researched, I'll do that. You can also reach me at healthcareadvocacy1, all one word, at gmail.com. Thank you.